Hello, I'm Diana Galata, Director of Communication Services for Prince William County Schools. And today I have with me Denise Hebner. Denise is an Associate Superintendent with our school division. So right now, if you look at some of the metrics in Virginia, especially in Northern Virginia, there is a rise in the number of cases of COVID. So as a school division, right now we have pre-K and first grade students whose parents have said it's okay for them to be back in person. And then we have the rest of the students coming back in January and in February. So looking at the metrics, can you help our community understand like what combination of metrics it may take for us to just halt the in-person learning and go back to an all virtual model?
So Diana, as you know, this pandemic is not predictable. And just when we think we have an answer, it changes. And so rather than latching onto one particular metric, we use a series of decision-making points. And at this point, what we're really looking at and focusing on is the virus and the situations in our schools. The community may have one level of positivity or one rate of transmission, yet what's happening in our schools may not reflect what's happening in our greater community. So we take a close look at our students and our staff and how well our mitigation strategies are preventing the spread of the virus in our schools. So that is one of our main focal points. We do obviously work in consultation with our health district, look at what's going on in our community around us, observing if our healthcare system is able to still effectively treat and maintain hospital care and health care for our community. That is something that we consider, but really our driving factors are the needs of our kids and our ability to provide a safe environment in the schools. So in addition to considering the virus and transmission of virus in our schools, we also have to look at our ability to safely staff our schools to provide an effective learning environment. So we would have to consider individual schools or possibly grade levels that may be impacted by that. Our decisions really are specific. It could involve a class, it could involve a grade level, it could involve an entire school, and in some cases, the entire division, should we receive some other type of directive from the governor or phase guidance that requires us to reduce our in-person learning.
So you mentioned a really good point about transmission in schools. So we have a dashboard on the front of our website, a COVID dashboard, where we share the cases frequently on a daily basis. And so I think it's important for people to understand that even if they're seeing a number of cases at a certain building, that doesn't necessarily mean the transmission occurred within the building. So can you kind of elaborate on that a little bit more?
Sure, absolutely. Currently, we have students and staff members that are working in our buildings or learning in our buildings, but also working and learning in the community. So in order to create a holistic picture of the general health of our staff and students, what we're aware of, we report on the dashboard. And I think that's an important point that, some of our staff members who are in a virtual setting, we may not necessarily have all of the data, but we really wanted to give an overview of the general health of our school family. We look at what's happening in schools and record that by positive cases. And we do so in order to make sure that our parents have awareness and transparency to help them feel safe about their students' learning and their students' individual situation.
Well, we appreciate it very much. You really do have a difficult job, but we know that you're working really hard and the team's working really hard to make sure that our staff and students are safe, and thank you very much for helping to explain that better to us today.
Thank you. It is difficult, but our staff and students are worth it. Our team is excellent, and we believe in our kids and in our teachers. Thank you for having me.